Howdy, my name is Jim, and if you're finding this, you've probably been researching back pain or back surgery or microdiscectomy or something like that. And I'm making this video. It's the fourth of a short series that I've been doing, kind of documenting my journey from initial pain through deciding what to do about it to getting the surgery, and then kind of the follow-up visits and where I am now. So if you want to know more about kind of how the pain started, how I chose surgery over conservative options, how the surgery went, and all that stuff, you can look at the other videos of mine, and you could also look. I've listed other people's videos in the comments section, because they were super helpful to me, and they probably will be to you. But where I'm going to go with this one is I'm going to try to keep it a lot shorter, and just tell you where I've been since the last one. Okay, so I think the last one was about 4 or 5 weeks ago, and it was after my first surgical visit, where I was cleared to go ahead and start physical therapy, and I could go back to work and that kind of stuff as long as I was careful. So progress has been pretty good. At times it has felt like 2 steps forward, 1 step back, but now it's more like 3 steps forward, 1 step back, 4 steps forward, 1 step back. You know, it's a stepwise progression, but it's constantly improving. Right after the surgery, I was encouraged by one thing. My leg felt like it was my leg again, and it felt like it was under my control, like the nerve was loose, and now I could actually feel it properly again. I was a little bit bummed because I wasn't one of the lucky ones where the pain just magically went away and it was all 100% better and blah blah blah. I kind of knew, because my impingement was, he told me it was in exactly the wrong place, and it was a large one. It had twisted up, well, not twisted, but really moved the nerve out of the way and was really squishing it. And it was for 6 weeks. So I knew from the testing that there was moderate to severe nerve damage, and I knew that it wasn't going to just get better automatically. I hoped it would, but you know, that just wasn't the case. However, like I said, I could feel like it was my leg again right after the surgery. It's gradually improved on at a pretty steady rate. I'm walking nearly every day, and I've gotten up to about 5 miles, as is the most I've done, I think, so far. And I've gone through 4 weeks of physical therapy, a couple days a week, plus doing exercises at home. The work so far has concentrated on strengthening the core to protect the back so that you don't get a reherniation, and on a lot of stretching and some strengthening stuff to get my leg muscles back in gear. And I can feel it's definitely getting stronger. My stride is getting better. I'm sitting here now at just over 7 weeks post-surgery, and I'm back to work. What else? Feeling pretty good, sleeping through the night. Got off the pain medicine that I did not want to be on, which was tramadol. But I'm staying on another one called gabapentin. The doc just says it helps. It's conducive to reestablishing that kind of mind-body connection during the process of the nerve sort of regrowing, regenerating. In my case, they told me it would be 6 months to a year, probably maybe even longer, before it to fully get back to normal. But I'm super encouraged by the improvement so far. And so I just got, we just ordered another round of physical therapy, and I'm sure we'll continue working on core stuff and a lot of stretching and things. They're kind of retraining me to like the proper ways of lifting, proper ways of, I mean, I know most of that stuff already, but it's good to get the reminder. And So a lot of core work, a lot of stretching, a lot more walking to come. He said that fairly soon, if I wanted, I could probably get in a pool and start swimming again. And so that's encouraging. He also said originally they had told me running would probably be a year or more in the future. And this time he said, when you get to the 6-month point, you could try that. But the main thing is like listen to your body. Be honest with yourself. If it feels like it's too much, it's probably too much. So my advice to anybody is really don't mess around. Like 75% of reherniations occur in the first 90 days post-surgery. So I'm listening to what they say. I'm impatient and I'm an athletic kind of person and I want to get going too, but I don't want to go through this again, and neither do you, I'm sure. So anyway, that's where it is. I just want to encourage anybody who's struggling with this kind of thing and worried about the surgery. The chances are very slim that something will go wrong. I was worried about that too. But I can say that I'm just super happy with the surgeon, super happy with the surgery itself, pretty happy with the outcomes, very encouraged, glad I did it, would encourage other people to strongly consider having the surgery and just getting this thing taken care of. But then after you have the surgery, following their advice, doing the physical therapy, learn the proper ways of taking care of it, and it'll try your patience at times, but stay with it because in the long run, you'll gradually get back to normal. You'll get back to your activities, and I will follow this up. Probably next thing will be maybe at the 3-month point, which is about 6 weeks away, and until then, take care, and I'll chat with you next time. Thanks, bye.